How is it in this day and age that anybody, any child, can die from a disease that's easily prevented by a vaccine? Well, the sad fact is that it's not just one child, it's actually millions of children. Some estimates as many as 3 million children a year die from diseases that you can easily prevent by a vaccine, kids under the age of 5.
Good health is a fundamental human right. Every human being has the right to access standard health services. In the second decade of the 21st century, medical technology has reached the capability to produce antibodies for vaccines to combat various illnesses. However, a large number of people in developing countries like Bangladesh are still suffering from lack of vaccination and otherwise curable diseases. The greatest challenge Bangladesh faces in terms of vaccination is not production. Rather, it is their distribution and preservation that are problematic due to the lack of electricity coverage and geographic disadvantages. Research has indicated Bangladesh's annual vaccine wastage rate is around 69 to 85% at ward level and Upazila level for diseases such as tuberculosis and measles. To solve this, Energize the Chain, an endeavor to expand the vaccine cold chain in developing countries, has developed a system to harness the power, distribute, and connect from available alternative power sources as remote cell phone towers and solar power plants. ETC Solutions creates an economically and technologically sustainable energy infrastructure for effective transportation, proper storage of vaccines, and medical supplies. United Group, Kazi Farms, and edotco Bangladesh, the largest telecommunications infrastructure provider in the country, have partnered with Footsteps to implement the cell tower-based ETC project in 2 sites and solar-powered ETC project in 1 site of Khulna's division Satkhira district, with the deployment beginning in 2021.
Footsteps is one of the most capable organizations I've seen in my lifetime, who are going above and beyond to help the marginalized community of Bangladesh. And when they introduced Energize the Chain initiative to me, naturally I felt inclined to help them make this dream a reality. I'm really happy United Group had the opportunity to work with Footsteps for this great cause.
We started working with Dr. Ruben Harvey back in 2019, and with our partners of ground for the last 3 years, we've been trying to find the best ways to implement Energize the Chain under our Shushasther Odhikar Shobar health program for the people of Bangladesh. And that is why we picked Satkhira, because we found out that the need for cold storage management for vaccines and access to vaccination and public health services was extremely critical in the southwest part of Bangladesh. It takes almost 5 to 6 months for a batch of vaccines from the national depots to reach satellite clinic at the local level. Most vaccines must be kept between 2 to 8 degrees Celsius all the way from the manufacturing plant to the person receiving them. To prolong the cold chain, local healthcare institutions in remote areas are targeted and provided with an uninterrupted electrical supply and cold storage to preserve the vaccines and medical supplies safely.
With the help of our partners, edotco, Kazi Farms, and United Group, for this pilot run, we are setting up refrigerator in the rural medicine shop. To monitor the activities of the refrigerator, we have set them up with RTMB device. RTMB device remotely sends the temperature, humidity, and door status of the refrigerator to our headquarters for maintenance and monitoring.
The cell towers of edotco provide the power supply for these 2 sites in Kaliganj and Tala Upazila, which we have connected through these wires and poles from the nearby cell tower. And in Devata, that model has power through solar panel. Now the refrigerators are all power connected and the temperature is maintained. We are hoping to move forward through a public-private partnership in the future.
It is hardly possible to maintain the required temperature throughout the whole supply chain. Due to the lack of proper cold chain system, a large number of vaccines are being wasted. We want to secure access and storage of medicines and vaccines closer to the end user, leveraging the existing reliable healthcare facilities. So, we are establishing a model program that can be adapted and scaled up throughout the whole country to prevent this wastage and further deterioration in the coverage.
Energize the Chain envisions to implement the initiative across Bangladesh through Footsteps SOS program. The process is very long and challenging, but in the end, it will impact millions of people, including mothers and children. It is an attempt to ensure equitable vaccination and medicinal coverage while simultaneously decreasing vaccine wastage in the country so that vaccines reach the underprivileged needing protection from preventable diseases.